Hi, I'm Dr. Shannon Ferguson, and this is Move It or Lose It, and today we are going to be doing hip mobility. Hip mobility and hip alignment is really important for lower back pain, SI pain, hip pain, knee pain, ankle pain, and foot pain. Hips are like the key to the lower body, and if your hips are off in any way, they are going to contribute to the other problems in your lower body. The first part in addressing any hip dysfunction is making sure that your hips can move. The other half is strength, and that's really important. But first, I get my patients to work on mobility and flexibility before they start moving to strength. Hip mobility helps the alignment of your hips, it helps your ligaments function better, and it helps your muscles function better. So start here and then move on to strength and more advanced mobility exercises. Okay, so to begin, we are doing range of motion. So I'm going forward and back 10 times. Each of these range of motion exercises will be done 10 times each. I'm not holding a chair for balance. I'm using this as an exercise in balance and also to strengthen my left hip while I work the range of motion of my right. But if you have issues with balance, please have a chair or a counter nearby to stabilize you. So this is back and forth. So I'm taking my right hip all the way out to the side and then across my body and going back and forth 10 times. In this video, I'm only working my right hip, but please make sure that you rewind and do the same thing on your left because it's really important to stay balanced with hip mobility, not just to work only one side. So this is what I call opening and closing the door. So it's internal and external rotation. So again, 10 times. And I'm really starting to feel the balance on my left leg there. So I'm starting to burn right in the hip, which is exactly what I want. So this is 90-90. So I'm going forward and then back on that hip. So I'm leaning forward and getting a stretch in those hip flexors, then leaning back and getting a stretch in those hamstrings. This is especially important to make sure that you do on both sides, because you want to make sure that you're getting that hamstring stretch and that hip flexor stretch on both sides. So the next exercise is more of a rotation 90-90 exercise. So with the knees pointing in the same direction, so in this instance to my left, with my weight over my left hip, and then you switch so that your knees are pointing to the right and your weight is on the right hip. And then we rock back and forth 10 times. So this is normal to scoot forward a little bit and shift across the floor. Don't worry about that. Just make sure that you are rotating back and forth, preferably without the use of your hands, but if you can't and you're not strong enough yet, it's okay to prop yourself up with your hands a little bit. And now we're going to do some stretches. So this is a standing hip flexor stretch. So grab your ankle like you would do a quad stretch. My arm is up to help me with balance, and then tilt your pelvis forward until you feel that stretch shift from your quad to right in the front of your hip where your hip flexors are. So I'm holding this stretch for 45 seconds. If balance is an issue for you, you can hold onto a chair or a counter, or you can do this on the floor, which I've demonstrated in other videos. And now we're going to do a glute stretch. So this is a figure 4 stretch on the floor. So pick where it feels best for you. For me today, it was ankle on top of the knee. You can also do mid-calf on top of the knee or even knee on top of the knee, which I've demonstrated in some other videos. Again, this stretch is going to be for 45 seconds. All right, and then we'll switch into foam rolling. So again, I'm doing my right hip. Make sure that you rewind after this section to do the other side. So I'm starting with the quad and the hip flexor. So I'm slowly rolling right up into that hip flexor and then back toward the knee. And you can control how much this hurts and how much you're working by how much weight you put into that foam roller. So if you want less, put more weight into your other leg and your arms. And if you want more, put more of your body weight into that foam roller. And now we are going to do the TFL. So that's that weird little muscle at the top of the IT band between the trochanter and the iliac crest of your pelvic bone. So it's not a very big muscle, so it's not a very big range of motion. I'm just going back and forth and shifting a little bit forward and a little bit back to get that whole area. And then to finish, I am going to foam roll the glutes while I'm in a figure 4 stretch. So tilt your pelvis a little bit so that all your weight is through that glute. And again, you can control how much this hurts by how much weight you put into the foam roller. So if you want less pressure, put more weight into your arms. And if you want more pressure, put more weight into that glute onto the foam roller. And make sure you shift toward midline and then toward the hip so that you're getting that whole glute muscle. And remember at this point to rewind and start again on the other leg. Thank you for watching my video on hip mobility. I hope that you enjoyed it. If you like this video, please subscribe to get more updates on stretching and pain-free living.